Have you been told that recovering from a frozen shoulder can take over a year? Well, I'm here to tell you that it doesn't have to be that way. Hi, I'm Dr. Dave Candy, and in this video, I'm going to give you some little known but effective tips to improve your shoulder mobility faster without increasing your pain in the process. Now, before we jump into the tips, it helps to understand a little bit about the nature of frozen shoulder. The terms frozen shoulder and adhesive capsulitis tend to be used interchangeably, but frozen shoulder is more of a clinical diagnosis, meaning a stiff, painful shoulder that's limited in all directions of motion. Adhesive capsulitis, on the other hand, is an anatomical finding where the capsule around the shoulder is inflamed and thickened, and that does limit your range of motion. But not all frozen shoulders have adhesive capsulitis. And it is very possible to have a shoulder that's stiff and painful and limited in motion without having adhesive capsulitis. So how do you fix a frozen shoulder fast? Well, there are claims on the internet about 1-minute cures for frozen shoulder, and I would warn you that if it sounds too good to be true, it probably is. Healing a frozen shoulder does take some time, but the tips that I'm going to share with you in this video will help to increase your shoulder range of motion in weeks to months rather than years. Now, these do work best for people with a clinical diagnosis who don't have true adhesive capsulitis on an MRI. But even if you do have adhesive capsulitis on your MRI, these tips will still probably be helpful. It just might take a little bit longer. Now, what causes frozen shoulder? The exact cause of frozen shoulder is unknown, but it happens nearly 4 times more in women than in men. It's more common in the 40s to 60s, and it's more common in people with diabetes or thyroid disorders. Furthermore, I've noticed clinically that almost all cases of frozen shoulder that I see tend to have a high level of nerve irritability. Now, the nerves to your shoulder all come out of your neck, and it's very common for people with frozen shoulder to have some underlying nerve pathology in their neck, particularly at the C5 level, which innervates the shoulder. So for the treatments for frozen shoulder, we're going to start from the neck and then move progressively down towards the shoulder. You want to start out with a good posture in your neck, avoiding a forward head like that. So you just want to do a slight chin tuck or a slight head nod. It's not a chicken neck where you're really pulling your neck back, but just a slight chin nod, bringing your chin down. That puts your neck in a neutral position and helps maximize the spaces where the nerves come out of your neck. And around the 40s to 60s, you also start to lose some space between your vertebrae. And so doing that slight chin nod position maximizes the spaces where the nerves to your shoulders come out. For the next treatment, we're going to use a stretching strap like this. If you don't have one, you can use a dog leash, or you can use a bed sheet, a beach towel, anything that's long and stiff. I'll also put a link to where you can get this on Amazon. You put one end of it underneath your bottom, so you sit on one end and pull the other end over your shoulder pretty close to your neck. Now this will pull down on your first rib, and the nerves that come out of your neck, they move over top of that first rib and also underneath your collarbone. So this helps hold the first rib down, and then you can stretch the muscles, the scalenes that attach to that first rib by just tipping your neck over to the side. This also stretches some of the muscles in this area of your shoulder that tend to get a little bit stiff when you have a frozen shoulder. Just tipping your head over to the side like that, about 10 to 15 times. You don't want to really push it. Just go till you feel a slight pull in the neck and then come back up. So that's the second exercise. Next, we're going to move down to the chest. The brachial plexus, or nerve bundle to your shoulder, next runs underneath your chest muscles, and particularly the pec minor. To release the pec minor, you can put your fingers underneath your chest muscles so that the back of your fingers kind of rub up against your rib cage. Then you're going to squeeze or pinch the chest muscles between your thumb and your fingers, and you may find a spot that feels somewhat tender. If you don't find a place, then you probably don't need to worry about this. But often if you have a frozen shoulder, you'll notice a notch or a trigger point in the chest muscles. So you just pinch and hold on that area for about a minute. You don't need to squeeze as hard as you possibly can. You want to try to localize that trigger point between your thumb and your fingers. The next area that we're going to work on is some of the rotator cuff muscles. Now these are the small, tiny muscles that stabilize your shoulder joint. And when you have a frozen shoulder, it's very common to have those muscles in spasm, where they're tight and they don't allow your shoulder to move in any direction. Now the first one is the teres minor. It's along the outside of the shoulder, and your teres major runs right next to it. So to work on those, you take your hand and just kind of pinch the little piece of meat right here between your arm bone and your shoulder blade. Now I'm raising my arm up so you can see it, but it's very likely that with a frozen shoulder, you're going to have your arm down here and doing it more this way, where you're reaching underneath in your armpit and kind of squeezing the muscles on the outside of your armpit. This is important because you have some nerves that run through this area. Your axillary nerve, which runs through the quadrilateral space to your shoulder, and then the radial nerve, which runs down the back of your arm. So just kind of feeling for tender spots in the muscles along the shoulder. When you find one, kind of pinch and hold gently on it for about a minute or so. Now the next muscle is going to be very similar to that, and that's the subscapularis muscle. It actually sits on the front side of your shoulder blade up against the rib cage. And the technique for this is somewhat similar, where you put your thumb in the armpit, but instead of pinching the muscles, you're actually going to put your thumb on the front of the shoulder blade. So reach back until you can feel like you hit a solid wall of bone, and you may have to press kind of far to feel this. Find an area where it's tender or knotted, and again, just hold a gentle pressure there for about a minute. The next area is in the back of your shoulder, a muscle called the infraspinatus. That's an external rotator of your shoulder, but it also limits internal rotation of the shoulder, which again is usually very limited in people with frozen shoulder. It's hard to reach that muscle on your own, so you can use a tennis ball to help release that muscle. To do that, you're going to take the tennis ball and put it on a bed or a floor. It is helpful to have something that's a little bit harder, so a floor does work much better than a soft bed. And you're going to lay with the tennis ball right underneath your shoulder blade, and you want it to be, for this one, directly underneath the shoulder blade. Move around until you feel like you've got pressure right on the shoulder blade. And again, this should be a little bit tender if you get to the right spot. And then lay there for about a minute. Additionally, the muscles between the shoulder blades, particularly the rhomboids, can get stiff. And that's important because as you raise your arm, your shoulder blade has to move on your trunk. And so you can release the rhomboids using a tennis ball as well. Just instead of laying directly on the shoulder blade, you're going to put the tennis ball between your shoulder blade and your spine. Now you'll notice that all of the tips so far haven't really focused on moving the shoulder. And that's because when you have a frozen shoulder, particularly during the early or freezing phases of the frozen shoulder, it's very painful to move the shoulder. So doing things that reduce the neural irritability, as well as help release the tension or stiffness in some of the muscles, makes it much easier and less painful to move your shoulder. But you do eventually need to start moving your shoulder. Now, one way to start moving your shoulder and moving your arm without going to the point of pain is to do what are called nerve glides. This gets the nerves in your arms moving and less sensitive before we actually start moving the shoulder itself. To do a median nerve glide, the nerve that runs down this way, you want to start out with your elbows at your side like this, bring your arm out this way, and then touch your shoulder, and then bring your arm out this way. You want to extend your palm backwards like that, and then come back up and touch your shoulder, and extend down, palm up, hand going backwards, come back and touch your shoulder, and repeat that about 10 to 15 times. Just go through the range that you can comfortably. If you notice that you get out to here and it starts to hurt, just come back up and go through what you can rather easily and comfortably. Next, we're going to work on the radial nerve. Again, that runs through the back of the arm through the triangular interval. And to do that, you're going to touch your waist like this, or as close as you can come to that. Then turn with your palm facing out, going this way. This is the nerve that runs down the back of the arm. And again, you want to repeat this about 10 to 15 times. Now we're going to actually start to do exercises that move the shoulders themselves. But there are really not that many exercises that you have to do actually moving the shoulders. It's just going to be a process of gradually increasing the range of motion that you do with these two exercises as your shoulder gets less painful and you get more motion available. So the first one is to work on internal and external rotation of the shoulders. To do that, you can start out with your arms out to your sides, and this is external rotation coming out like this. Then come in this way as if you're trying to touch your hips or go past them. That's internal rotation. Come back out to external rotation. Internal rotation, external rotation. This is important because external rotation in this direction is necessary for you to be able to raise your arm up above shoulder level. And so you want to work on the rotational ranges of motion before you aggressively push up into raising your arm up. So again, external rotation, internal rotation, external rotation, internal rotation. Do about 10 to 15 of those. And now we're ready to move on to the shoulder flexion exercise. Flexion is the motion of moving your shoulder forwards like this, going into an overhead position. And to do this, you want to start out with your forearms parallel and then just raising them up as high as you feel comfortable going and then coming back down. It is important to maintain that external rotation. Go up as high as you feel comfortable going. Then you can shrug your shoulders up a little bit to get the shoulder blades into the motion. Go out into external rotation, into shoulder flexion, shrug up a little bit, and come back down. Now, if that's hard for you to do, there is an alternative variation you can use, sliding your arms up a wall. That helps offload the weight of your arms and allows you to make the motion a little bit easier. So you have forearms parallel, slide up the wall as much as you feel comfortable going, shrug up a little bit, and then come back down. Slide up the wall, shrug up a little bit, slide back down. So those were the tips to help with the frozen shoulder, particularly if you have a really irritable, painful frozen shoulder. But keep in mind that diabetes is also highly linked to frozen shoulder. So if you haven't already, it's a good idea to check with your doctor about getting your blood sugar and A1C checked. Additionally, thyroid disorders are highly related with frozen shoulder. So if you haven't had your thyroid checked, I'd also check with your doctor about that. Now, if it comes back normal, but you still suspect that there may be a problem, there are some more thorough thyroid panels. And I've got another video explaining more about that up here. And additionally, there are more tips to help relieve shoulder pain in this playlist down here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.